This is an EEG of a 35-year-old woman with a history of altered mental status. As we look at this EEG on the first page, we can see there's a lot of eye movements, lots of eye blinking. It looks like a lot of underlying muscle artifact. And of course, the first thing we want to look for is the posterior dominant rhythm. Now here we see the patient's eyes are blinking, so her eyes aren't closed, so it's a little bit difficult for us to look for the posterior dominant rhythm. Now here the technician says that the patient's eye is closed right here, and when we try to count this, it's pretty, it looks like there's about 2 to 3 waves here in 200 milliseconds. So this is between 10 to 15 hertz. If we count this out, it's about 13 hertz. So that's, bordering on beta frequency activity. The background does look symmetric between the sides, and the amplitude, if we measure, it looks like it's probably around 20 to 50 microvolts. And in terms of the organization of the background activity, the frequency amplitude gradient isn't as well organized, and that's because we see a lot of beta activity diffusely throughout the background. Usually we just see the low amplitude fast activity in the anterior head regions, but here it's sort of persisting through, and the background is very spiky looking. This is abundant beta activity. Now beta activity, remember, is 13 to 30 hertz, and beta activity can be brain generated. It's usually seen during drowsiness in the frontocentral head regions when it's brain generated. It also can be induced by exogenous medications such as benzodiazepines or barbiturates. So I suspect that this patient takes a benzo, and that's why her background has so much beta activity and it's so sharp looking. Okay, so the tech mentioned that the patient is hyperventilating, and we now are not really seeing too much of a difference. A little bit of artifact there. And more artifact there. It looked like an electrode was popping off. Same with here at T3. We can see this mirror image here. That's an electrode pop. It looks like there is a little bit of asymmetry here in this region. Some waves here that we're not really seeing on the left side in the left parieto-occipital region, so we'll just keep an eye on that area. And it's sort of becoming a little bit more obvious here. So this looks like delta activity. It's somewhat rhythmical. Now, it's definitely asymmetric between the other side. This looks like artifact, and the reason for that is if we see activity that looks so rhythmical and high amplitude in these two electrode chains, you would expect to see something in this chain as well. If this activity is significant enough to cause this type of rhythmical slowing, you would expect that the neurons underlying these electrodes would also be involved. We can also change the montage and look at an average. And here we can see that that activity is really just isolated to one electrode here. So that's probably something wrong with that one electrode, and it's not due to brain activity. And as we do go forward here, even on the other side of the page, we start to see this electrode pop artifact, so that mirror image configuration. So that electrode is just popping, and that's why we were seeing that artifact. It's important to be able to recognize artifacts. So that's a classic looking electrode pop, and we can see as I back up here it's still popping there. And lots of blinks. This patient is just continuously fluttering her eyes. They're probably closed, but she just has those little fluttering eye movements. And more of that P4 artifact here. So far the patient is awake. We haven't seen any clear-cut drowsiness or sleep activity. I'm just backing up here because this may have again caught your eye, and this is more of that electrode artifact. Again, we can put it into the average reference, and there we see it is just localized to one electrode, so it's likely a problem with that electrode, and we know that electrode is popping. Definitely catches your eye, though it stands out from the background. But again, if this truly were slowing or sharp waves, we would see a field. So we would be able to see something in the electrode chain adjacent to that. Here as well. Okay, so maybe a little bit of drowsiness here. We see the background looks diffusely attenuated, and then waking up, we see that abundant beta activity again, and more of that electrode artifact as we proceed forward. Okay, so it looks like the tech is asking the patient some questions, and there's the end. So this is an abnormal EEG. I would say it's a mildly abnormal EEG due to the presence of abundant beta activity, and this is likely secondary to medication effect from benzodiazepines or barbiturates. And you do want to mention that no epileptiform activity or electrographic seizures were seen.